Hello and welcome back, friends. This is Michael Yates with the Ridgeview Pod. We're glad you've joined us and you've allowed us to spend a little time with you today. As always, we ask you to subscribe, ring the bell so that you get notification of our latest episode. I'm very pleased to have my guest today, Michaela. It's so good that you're finally here. I can't believe it. So we were just talking about where did this all begin? And so I pulled up an email from December 29th of 21 from our dear Laura Connor with the health director for the Roane County and Morgan County Health Department. And she had reached out to Ann Pirtle and me about a new role with the health department around harm reduction navigation services through the health department. And that is certainly caught my eye because all of our, much of our substance use disorder treatment is a harm reduction model. So to begin, McKayla Gallaher, tell us who you are and what your role is.
Well, like you mentioned, I'm the Harm Reduction Navigator at the Roane County Health Department. That's also known as the linkage coordinator. What I mainly do is I work with those that have substance use disorder, struggle with substance use disorder, linking them to services such as detox, inpatient, outpatient, maintenance programs, MAT programs. I also link them to places such as like Choice Health Network that just provide different harm reduction resources or services. I also have been lately just linking people to other resources like housing and shelter, food, transportation, different things like that. There's a huge need for a lot of that in our county that I've came to realize. So I've been doing my best to help anyone that I can with those resources as well. So that's kind of a broad or
Yeah.
general.
Well, and this is specific to Roane County, right?
It is specific to Roane County. However, if someone calls our health department and they're based in a different county and they ask me to help link them to resources, I do so. I give anyone information that I think could help them. It is mainly for our county. We are a high impact area. So as far as population and overdose percentages, we're pretty high on the list for East Tennessee. So that's why I was based in Roane County. That's why this position was based there.
Yeah. No, it makes sense. I love this term navigator. It seems certainly the mental health system, the public health system, we have very complex systems for people to literally navigate. So to have a position that is dedicated to helping people navigate a complicated, complex system is not only money well spent, but time well spent. So how's it going so far? I mean, are you seeing the benefit of this role in helping connect people to the right stuff?
I had spent the first 6 months trying to make connections. That's mainly where I focus with different treatment facilities, behavioral health facilities to treatment facilities for substance use disorder specifically. And I didn't really get to navigate that many people from August to January. My numbers were pretty low, but in the last 2 months, I'm very proud to say that I have already navigated more people in February and March than I had in those 6 months combined. So my numbers are definitely growing. I think that it has a lot to do with building trust with the community, as well as making those relationships and building that rapport with different facilities. So
Yeah.
it's starting to go well. I'm very, very optimistic and excited.
That's great. And we hope that this video podcast will only help enhance and amplify the resource that is available. So let's walk through like how it might actually work. I'm a Roane County resident. I get connected with the health department. I have a history of not only trauma in my life, but I've lost my job, my family to substance use. I don't know what to do. How is it that I get connected to you? How does that actually work?
Well, I making those relationships with different places. Hopefully, I do get referrals from them sometimes. Community-based, like faith-based organizations in the county have gave me a lot of referrals that work with people that are unsheltered, just different people they come into contact with. We also have this Cage AIDS survey, which is just 4 questions that are meant to be less stigmatizing than the usual questions about substance use disorder and alcoholism that were used at the health department. And through that survey, the nurses refer people to me internally. We have people that sometimes just get to a point where they don't know who else to call. So they call the health department and ask for help. And now there's a position there for them to be referred to. So I've got referrals many different ways, but that what ties to this position would probably be that KJ survey that we use.
So can I self-refer?
Yes.
So Is there a specific number or an email that I would use?
Yes, there is. This paper here kind of has all the services I help link people to, as well as my contact information. I also have a big poster that I've been going around and posting different places and just handing out my card anytime anybody seems like they would like one or, that it seems to be beneficial. So
we'll make sure that information is included in the comments section of the podcast. And when we share it on Facebook, if you have that in electronic form, we'll also include that information as well, if that's helpful.
I do have it, so I'll send it to you.
Now, do you, let me make an invitation. If you've not been to Ridgeview, in our Harriman Clinic location, we invite you to come out and check us out. I don't know if you've had a chance to meet Ann Pirtle yet.
I'm not sure if I've met her personally. I did not long ago, though, do a presentation for the STOP program.
Oh, fantastic.
So I was able to do that. I've kind of just been, anytime someone offers to let me come in and speak and let people know that this resource is at the health department, I'm more than willing.
Wonderful. Well, that's good. Those are the right groups. So the STOP and the MIST program both are our primary community-based substance use disorder treatment programs, harm reduction. Now, are there other things? I notice Laura made reference to prevent the spread of communicable diseases such as hepatitis C and HIV. Are there trainings about that you provide?
I don't provide trainings. However, I'd mentioned Choice Health Network a little earlier. I do go and work with them sometimes. Like if they need extra hands or something, they do a lot of HIV testing and Hep C testing for different areas in East Tennessee. So I've anytime that I can be of assistance to make that go smoother or let them be able to do that more than I do. But I don't provide trainings. I wouldn't be opposed to doing that, but I would probably need to be trained to do that first.
Yeah, so. Sure. No, it makes sense. Well, I know that you're certainly getting out there. We recently were in the Roane County SIM, sequential intercept mapping, 2 weeks ago, thereabouts? Yeah. So what'd you think of that?
I really enjoyed it. I'd never been part of something like that before, so I was very honored to be able to do so. And it was very interesting, and it was nice to meet a lot of people that have, a lot to do with our community and try to help make it, as great as it can be. So that was nice.
No, it was the first time I had been through something like that as well. And I too found it interesting, but it also confirmed for me, as I said just a moment ago, about the complexity of navigating our systems of helping people. And there were a lot of programs and services that it seems like do exist in the county, but it was, in many ways, we become our own worst enemy at trying to, we're so siloed, that helping people navigate where they need to be remains one of the biggest charges. And that seems to be the purpose of mapping. So, well, Well, is there anything else you want to get out there about your role, or in addition to the numbers that we can provide? If folks are wherever they are in their struggle with addiction, this is a resource to take advantage of. It's not limited to age, I take it, so it can be beneficial for both adults and children.
Right now, it's kind of set up for adults,
Okay.
but I do have some resources that, as I've been researching and making calls and trying to connect, I've found some amazing resources for children, and I would never withhold those from anyone.
Yeah.
So if they have any questions or anything that I can just let them know what I know, I am more than willing to do so.
Yeah.
Yeah, I just kind of, I guess mainly I want people to know that regardless of where you're at on the stages of change, whether you're ready to make a change or not, I want people to know they always can feel free to call me. And I will meet them where they're at and not push anything that I think on them, or what I think they should do. I very much want people to know that it's a non-judgmental atmosphere that I do my best to provide. So
Well,
that's important to me.
in the 2021, a resounding theme that seemed to keep coming up through the 47 podcasts that we did was a judgment-free zone. So you saying that made me think about, that is one of the purposes and intents of this effort to elevate community awareness, is that people know that there are judgment-free zones out there to get connected to help when they need it and when they want it. So,
Absolutely.
yeah, I'm always curious, how people take care of themselves. And I think a lot of folks are looking for, ways to maybe integrate what other people do if they're struggling with self-care. So how does McKayla take care of McKayla?
Honestly, I self-care is a big deal for me, but it looks different depending on where I'm at in life, I guess is the best way to say it. Sometimes it looks like taking a walk, so many times a week. Sometimes it looks like something as simple as getting my nails done, just something that is just taking time, to focus on myself and make sure that I'm where I need to be mentally and emotionally. So
Yeah. Well, you seem to be doing a good job. You've always got a good smile on your face and a positive outlook, and those are very contagious. So,
thank you.
well, I hope you will indulge me in just a few questions here. These are some get to know McKayla kind of questions. We introduced this at the beginning of our 22 podcast, just to help allow our viewership to not just hear about the business of what people do, but a little bit about them, because people are important. So I always have to get out that I steal these from a podcast I follow, Greg Bennett. He's a triathlete, retired triathlete that I admire greatly. And these are always some fun questions. What's your favorite vacation?
My favorite vacation, probably to the beach, honestly. Or is it a favorite one that I have taken, like a specific one, or just a type of?
Yeah, type of.
Yeah, to the beach then,
Do
probably.
you have a favorite beach to go to?
Well, I lived in Port St. Lucie, Florida for a while, so I like going there just to, I don't know, it reminisce, I guess, as well as see the beach. So, and it's a beautiful area.
Now, is
So,
that on the Gulf side or Atlantic?
geography is not my strong suit.
What's the big city near it? Is it
um,
Tampa or?
It is close to like Fort Lauderdale. It's
Okay.
a little north of Fort
Okay.
Lauderdale.
So yeah, down there on the Atlantic side.
Okay.
Okay. Yeah. Now that's a good spot. What are you currently watching on Netflix?
Oh, I'm actually not watching Netflix. I'm watching Stars. Outlander just came back out. A new season of Outlander, and I really like that show.
Okay.
So,
Yeah, I see the teasers come
yeah.
across my feed, but I haven't fallen into that one yet. Uh, Two most used apps on your phone.
Oh, Probably Facebook and I'm not really sure. Let me think. I use my health app to look at my watch and how many steps and stuff I take through the day. So that may be the second one. I track quite a few things on there. So.
All right. Very good. What dinner could you prepare?
I just made creamy Tuscan garlic shrimp the other day, and my family really liked it, so I
Wow,
can cook that.
sounds delicious. So let's say you've prepared that. What three guests, non-family, would you invite? And they can be living or deceased.
Okay, probably my neighbor Denise, um, and I have two really close friends, Kiki and Karina. So if I could get
All
them both there,
right.
then I'd invite them.
Sounds like they would enjoy that meal a lot. Now, after they watch this, they're going to say, make us that meal. So, uh, let me see here. Now, this is a very important one. Should pineapple be allowed on pizza?
I think so, because sometimes I like it. So yeah.
Yeah, it's my wife's favorite. Canadian bacon, the Hawaiian pizza.
hmm
Yeah. Uh, where is somewhere you haven't been, but you'd love to go?
Ireland.
Oh, really?
Yeah.
Why Ireland?
I'm not even really sure. It's just somewhere I've always wanted to experience. I think that a lot of the structures there, they have a lot of historic buildings and structures that I think that would be really cool to see. And my son's name is Declan Fane, which is a very Irish name. And our last name's Gallaher. So
Yeah. So it's not that though we're recording this the day after St. Patrick's Day.
no,
It's not
no.
because. All right. All right. Very good. Well, that's cool. And then lastly, what's the greatest movie of all time?
Oh, I'm not sure. That's a hard one. That's a really difficult one. I would probably have to say I could tell you my show. What about show? Can I say
All
show
right.
instead?
Sure.
House. House is the best show of all time,
Oh, okay. All right.
in my
Now
opinion.
they've quit making that, right?
Yes, they did, and
Okay.
I didn't watch it until it actually was completely done being aired and filmed. Yeah, I watched it all together and was very
Yeah.
upset when it ended because I loved it.
Oh, yeah. Well, I mean, what's happened nowadays with the whole way to binge shows.
Yeah,
I am through two of four seasons of Ozark.
I
Have you?
just watched it. Yeah.
Yeah, did you? Man, it's I need a little break from it. So yeah, I just completed the second season, but yeah, it's quite good. It's
Yeah.
quite good.
Yeah, I like it keeps your attention for sure.
Uh-huh.
Yeah.
Uh-huh. All right. Well, McKayla, thank you so much for coming in. It's been a pleasure to have you. I know this took us time to get here to record this, but I hope you'll come back maybe towards the end of the year and we can look back on what has worked well with the navigator position and maybe what hasn't, and what are some opportunities to further bring the attention of this resource to the community. So,
Absolutely, that sounds great, and thank you for having me. I really, really appreciate it, and I think it's amazing what you guys do. So,
yeah.
thanks for having me.
Well, thank you. And thank you for tuning in, folks. We always appreciate you making time out of your day to check in with us. Please don't forget to subscribe, ring the bell so that you get notification of next week's episode. And please continue to take good care of yourself. Bye bye. All right. Pretty painless.
And yeah, it was.